Hello and welcome, it's Dr.sun. Today I'm going to talk about the neuroendocrine tumors. We call it NETs, NETs, and also we'll talk about the pancreatic neuroendocrine tumors. So let's get into it. Neuroendocrine tumors or NETs are a heterogeneous group derived from the neuroendocrine cells in many organs, including gastrointestinal tract, we call it GI tract, lungs, adrenal means the phaeochromocytoma, and thyroid, medullary carcinoma. Most NETs means the neuroendocrine tumors occur sporadically, but a proportion are associated with genetic cancer syndrome. It's really important, such as MEN means the multiple endocrine neoplasia type 1, type 2 and type 3, and also neurofibromatosis type 1. And we are talking about the NETs means the neuroendocrine tumors may secrete hormones into the circulation. Now we talk about the gastroenteropancreatic NETs arise in the organs that are derived embryologically from the gastrointestinal tract, we call it GI tract. The most commonly they occur in the small bowel, but they can also arise elsewhere in the bowel, pancreas, thymus and bronchi. Now comes to clinical features. The patients with gastroenteropancreatic NETs often have a history of abdominal pain over many years prior to diagnosis and also usually present with local mass effect such as a bowel obstruction, appendicitis and the pain from hepatic metastasis. Now we talk about the pancreatic NETs. Most of the pancreatic NETs can also causes hormone excess, but most are non-functional. Please have a look. Now you can easily understand that tumors are the gastroenoma, insulinoma, vipioma, glucagonoma and the somatostatinoma. Now the gastroenoma, they secrete gastrin and the effects are the peptic ulcer and the steatorrhea. Now insulinoma, they secrete insulin. The effects is the recurrent hypoglycemia. It's really important. And the vipioma, they secrete vasoactive intestinal peptide, we call it VIP, and the effect is the watery secretion, means the watery diarrhea and hypokalemia. It's really important. Now the glucagonoma, they secrete glucagon and that leads to diabetes mellitus. And the somatostatinoma, they secrete somatostatin and that leads to diabetes mellitus and the steatorrhea. These all the consequences and the effects you really need to understand, and it's really important. Now we talk about the investigations. A combination of imaging with ultrasound, CT, MRI and radio level somatostatin analog will usually identify the primary tumor and allow staging. Is really important, which is crucial for determining prognosis. It's really important to understand. Now the biopsy of the primary tumor or a metastatic deposit is required to confirm the histological type. Now comes to management. The treatment of solitary tumors is by surgical resection. If metastatic or multifocal primary disease is present, then surgery is usually not indicated. You really need to understand, unless there is a complication such as gastrointestinal obstruction. The bottom line is the neuroendocrine tumors are really important, and if you have any symptoms of neuroendocrine tumors, you should visit your doctor and treat them well. That's all for today. Thanks for staying with us and have a great day.